In this episode, I'm bringing on my very special friend, Toni Furrow. Toni is a family nurse practitioner, a mother, an author of children's books, and a foster home owner. She is an amazing person, friend, nurse practitioner, wife, mother, and author, and has so much knowledge and experience and wisdom to share with you. She worked in two specialties, endocrinology and palliative care as a nurse practitioner in Hawaii and in Texas. So she is a perfect person to talk about the pros and cons of going into specialty field versus practice in primary care. She will also share how she balanced career with being a wife and a mom. So let's dive into this amazing conversation with Toni Furrow. Aloha, I'm Miki Miura, a family nurse practitioner in Hawaii. I've been a nurse practitioner for 10 years, and I absolutely love being a nurse practitioner and the lifestyle that career has given. My passion is mentoring nurse practitioner students and new grad nurse practitioners to build amazing careers so that they can have the freedom of choice on what they want to do and how they want to live. All right, let's get into it. Thank you, Toni, for joining this interview. I'm so excited to talk to you today.
I'm so excited to be talking to you too, Dr. Miura.
We went to nurse practitioner program together in Hawaii. She now lives in Houston. She worked as a nurse practitioner in Houston, and she does so many other things that she's going to share with you. But she works in a different field. She works in palliative care. And then also she used to work in endocrine. So she's going to talk all about that and then the motherhood and stuff like that. So this is going to be a very exciting interview. Toni, first of all, can you briefly introduce yourself?
Sure. So I'm Toni Furrow. I have been a nurse practitioner for several years now. I think I graduated the end of 2014, if I'm not mistaken. I got my bachelor's degree in 2009 from Bowling Green State University. And as you mentioned, got her master's at Hawaii Pacific University. I started out as a nurse practitioner in a private endocrine clinic in Hawaii. And then my husband and I decided to move to Texas to be closer to family and continued in endocrine at MD Anderson Cancer Center. And I was there for about 5 years. And then once I had a pretty established family with 3 kiddos, I decided to take a step back. And so now I'm back in hospice care, working as a nurse practitioner, PRN. And I had done hospice care as a registered nurse. So I'm back with my first love and really enjoying it.
That's awesome. And beside from your nursing career, you write books for children.
Yes.
Tell me about that.
So I have 2 Christian children's books that I've written. I actually have them here if I could just show everybody. So this one is called Jules' Patient, and this is on the fruit of the spirit of patience. And then I have the other view is kind. So this is on kindness, and both feature my kiddos, but they're just really sweet stories for those who are really interested in discipling their children in the Christian faith. They're just really sweet stories. And at the back there is basically a mini Bible study where it asks questions in scripture to help answer those questions and go over those with your kiddos. Another thing that we're pursuing, actually just this past Friday, we officially became a licensed foster care home. So that's on the horizon. So we're very busy here.
And I don't know if you're comfortable with sharing your husband's profession, but he's often away due to his job.
Yes, he's a United Airlines pilot. So he is based out of Houston, but yes, he's gone about 4 days a week on average, I would say. It's really give or take, and every month it changes. But yes, we are very busy here.
So guys, she's gonna talk about the motherhood of how to balance, family and work and career and stuff like that. I think many of us are interested in that as well on top of her career journey. Wonderful. And I will definitely put the links and the detail of her children's book and stuff like that. So if you guys are interested, look at the details. So you worked in the endocrine, and we both graduated from a family nurse practitioner program, and we are both family nurse practitioner, and a lot of the audience might be wondering, so I have a FNP certificate, and should I go into specialty, or should I just go into general primary care, urgent care? And how did you decide of the specialty?
Yeah, that's a great question. And I think for each person, it's going to be a different answer. For my story, I don't think I really did decide. I interviewed at multiple different places. I interviewed with the endocrine clinic. I interviewed with a family practice clinic, with Minute Clinic. And I think those three were the primary ones that I was looking into. I received offers from all three. But after praying over it and meeting with each provider or management for Minute Clinic, I really felt going to the endocrine clinic was going to be the best way for me to really learn. Because as much as we study, as much as we do in school, a lot of our learning is done in the first year or two once we graduate. And the physician that I interviewed with was just phenomenal. I knew without a doubt he was going to be amazingly supportive, bring me under his wing, help guide me.
And he
did
loved
just
you.
that. I mean, he was amazing. I
adored
loved
you.
him so much. Yes,
Well,
he was wonderful to work with.
And you are a wonderful person and wonderful providers, such a hardworking and excellent bedside manner. So I can see why he loved you so much. But so there are a lot of things that I think a lot of audience are interested to unpack. First of all, how did you find those job opportunities? Like for me, I went into Craigslist. I don't know if Indeed was the thing back then. But also I actually knocked the door of different clinics and then give out my resume and cover letters. So how did you find your job opportunity?
That's a really good question.
Yeah,
Let me
and
search
it's
my
been a long
memory
time.
bank. I'm like,
I know.
how did I do that?
It's been a long time, and it wasn't on the list of questions that I was going to.
Fine. I am sure that I used some sort of search engine. I don't remember what it was. I honestly don't remember what it was, but I remember going in and filtering specific titles for jobs. So it was like practitioner, okay, and then it would filter through. So it must have been some sort of healthcare search engine. And I believe that's where I found most of them. Also, just talking with fellow classmates and hearing where they were interviewing and getting ideas through that. Minute Clinic was one of those. I feel like a lot of us had some sort of, and they were a great option. They were really great for new grad nurse practitioners or people who really want a set group of people that they'd be seeing and management growth potentially.
For sure. And I interviewed Elizabeth, who were our classmate as well.
Yes.
And she also mentioned that we as classmates, back in the day, the class was in person. And we also have an excellent, wonderful cohort that we just really try to survive together. It wasn't
we were in it together.
Yeah, we're in it together. We weren't like rivals or anything. So we're like talking and exchanging information. So like you said, even for job search, like unfortunately at the time, I sound old. I think internet wasn't useful as right now. The information about how to look for nurse practitioner jobs weren't out there. Big hospitals weren't hiring nurse practitioners really back then either. So we didn't know how to look for jobs. So we exchanged information like, hey, how did you do it? Let me look into that. So I think I would definitely recommend for you guys to connect with your classmates and exchange information, because one is you get more information, but also you get more mental support from your classmates.
Absolutely.
Yeah, so I think
absolutely.
Yeah, I think we lucked out, and I'm very thankful for you and Elizabeth and other classmates. But yeah, that's awesome. So there are some pros and cons of going to specialty versus being in primary care. So what would be the pros and cons of being in specialty? Endocrine is a very specific.
It's
even
very
more
specific.
Yes. So what were the pros and cons?
Yeah. So for me personally, I think there are many more pros than cons when you specialize. You go from being a novice beginner at something to being an expert in something at a much faster pace. which I really appreciated. And I think the great thing about the endocrine specialty is it's very nuanced. And so one of the cons people could say is, oh, I'm going to get bored of doing the same thing every day all the time. Endocrine is so nuanced. I feel like every day I did it for 7 or 8 years. And even at the end of that tenure, I was still learning new things. So it was incredible to have the knowledge, the deep knowledge that I had and still have in endocrine. I would say one of the cons, and this might be backing up to the track that I took for my master's program, but one of the cons might be that I really just focused on adults. And that was because the private clinic I worked at, and then MD Anderson, it was adult care that I was providing. Pediatrics weren't really offered where I was. And looking back, should I have done my FNP or should I have just done adult? Because I really never used my pediatrics. But that being said, now I'm a mom of 3, so the pediatrics has come in handy a little bit along the way.
That's so true.
But another one of the cons that I would say is because you're really just focused in one particular area, I don't want to say lose the knowledge base, but it definitely gets foggy. I would text you to say, hey, what are the screening guidelines for whatever women's health question I had?
And guys,
just because I wasn't doing it.
This is a fact. And I also did the opposite. Hey, what is the normal for TSH for pregnant women in first trimester? So again, having classmates, really important. Because like people go to different fields and then I can ask about your client. Okay. It's truly be friends with your classmates.
I absolutely 100% agree. It's so great developing those relationships while you're starting out and then building on them as you're all growing, and having that person to do a quick curbside consult text like, oh, okay, hold on. I think I know what this is. I just want to just please confirm for me what I'm thinking is right. But yes, I really enjoyed the specialty side. I enjoyed the fact that I was not a primary caregiver, that I could really take my 15 minutes of time with this patient and hone in and really help them with what I could manage, and not have to worry about several other health issues going on. Of course, they're always considered in your diagnosis and planning and management and everything, but it was a benefit for me to not have to really take on everything and just hone in on one particular system.
And then client is still, like you said, it's still very broad because it covers diabetes, osteoporosis, hormonal imbalance, thyroid issue, to high prolactin level, to there's so many things that you wouldn't think. Is this endocrine? And then
that's why every day I was always learning.
So I think I totally agree. I got a job offer from primary care and women's health, and I decided to go into women's health. Not saying that people should definitely go into specialty. I think everybody has different preference, and there are huge need for primary care provider. So I definitely, if you're interested, go for it. This country needs you. And also I do primary care as a women's health, so it's like in between. But when I was deciding my first job, I chose women's health because I felt more comfortable in limiting my field, so I can be confident. I know this field very well, instead of I have to know everything, which is not really true. That I think nobody knows everything. As a new grad, confidence is something that I had to overcome. So I think choosing specialty was good. But I think you mentioned that you have to have a good mentor because you're very new. And did you learn endocrine during FNP program?
Like surface level. Yeah. I would say it was very surface my first year at the office. And when I was in Hawaii at the private clinic, it was all endocrine. So I was seeing patients with pituitary tumors, functioning and non-functioning, thyroid issues, adrenal issues, osteoporosis, diabetes. Yeah, basically every pituitary and organ axis you could think of. That's what I was seeing. So I really dived in deep to endocrine everything. And then once I went to MD Anderson, I didn't think that there could be anything more that I could glean, but that's just not correct in healthcare. Things are changing. New medications are coming out all the time. And MD Anderson is even more subspecialized because the patients are just so special, coming in with any sort of tumor or malignancy. And so even their endocrine department, each physician subspecializes in a particular disease or two or along those lines. And so there I saw a lot of pituitary tumors, a lot of adrenal nodules, and unfortunately adrenal cancer and osteoporosis, and didn't really do much diabetes at all there. And we had a whole diabetes team that managed that. Yes, there's a lot to learn, a lot more than we covered in the short time we did it.
Oh my God. Yeah. Like you feel like when you graduate from the program, you feel, you study as much as you can, but then there's so many things to learn. And like you said, healthcare medicine is changing every day. So you have to catch up with the progress as well. So it's never ending, which is a fun part of being a nurse practitioner.
It is. If you are considering going into a specialty, one thing I would really recommend within your first year, if your employer is able to negotiate this, is to be able to have the opportunity to go to a specialty conference, whatever that specialty is that you're going into. If you're able to negotiate that into your job acceptance or whatnot, to have that in there so you can go and obtain that deeper knowledge, that's just going to equip you even more for that first year when you're there. That's something that I had the opportunity to do, and it was phenomenal. I came back and I felt, okay, I can see this patient by myself. I don't need to, I felt so much more confident coming back. And
was that something that you negotiated during an interview as new grad, or just
I didn't. It was just, so being able to have leave for a conference was a part of the negotiation, but I didn't specify an endocrine specific conference. I just made sure I had the leave time for it and then some sort of compensation for it, right? Like some set aside to be able to go to a conference. But I was just like, okay, what do I really need to focus on? Endocrine. And so that's where I went. And it was a conference at Harvard, and it was amazing. And I came back, and even the physician was like, wow, okay, you're asking deeper questions, and now you're making me think. So it was good.
Wow. And that's such a good advice, because as a new grad, you don't know what to ask for when you are negotiating and doing job interview. And I didn't have any idea about that either. And after I became a nurse practitioner and work in women's health, there was a time that I was asked to work in rheumatology. Then I already had some experience and knowledge. So first thing I asked was if I'm going to change my specialty, you need to set up and let me go to a conference. But as a new grad, you might not know that's something that you can ask for. But I think it's a win, because your employer want you to be competent. They don't want to be responsible for malpractice lawsuits. And then you also want to be confident and comfortable with what you do. So it's
absolutely. Yeah, absolutely.
And for those who are not familiar with MD Anderson, I just want to mention that MD Anderson is the top-notch cancer center in the United States. She was seeing one of the most complicated, difficult cases. It's such a wonderful that you were able to work there. I was so proud of you. When you told me that you're working there, I was like, oh my God, wow.
I couldn't believe it. I'm like,
Hawaii.
Really, me?
No, I can't believe it. It's just, I was so proud. That's so amazing. Let's see, a couple of things. I think one of the con I want to ask, I was thinking a con of being specialized is when you look for another job for whatever reason, you have to change your job. Maybe you have to move. In fact, you had to move to another state. And because you're so specialized in a specific field, do you think that was really limiting your job hunting, job opportunity?
Yeah, that's a really great question. So I will admit that I did not look for anything that was outside of either endocrine or hospice. So I don't know if it would have I was really interested in staying in my niche and what I love to do. And I knew what those two things were. I will say I talked to a couple of general providers, family practice providers, and when they found out that I had endocrine background, they seemed to ask a lot of questions like, oh, and so would you be interested in doing this? So would you be interested in managing diabetes? From my very limited experience, I feel if you are a compassionate person, a responsible person, have great bedside manner, respectful, responsible, just all of those things that make a great provider and make a great employee or a partner to work with. Being specialized, I don't think would be a downside because you would be coming in with a deeper knowledge than maybe anybody else in that practice. And so that's really an asset. I don't know if I would look at being specialized and then maybe wanting to branch out into something else necessarily as a con. Although I can understand your learning curve might look a little bit different, but there's a learning curve for almost everything. Learning how to do a new EMR is a learning curve. Right. I feel like maybe the additional knowledge or the deeper knowledge might be attractive to some employers.
That's amazing point that, I didn't really realize, but that's so good because even for myself, if I decide to work in primary care, they might say, oh, you're specialist in women's health. Can you just handle all the women's health there? I can see that point. That's such a good point. So I guess don't be afraid of specialize if that's something that you really want to.
Absolutely.
And then you end up working in the understand. So, wow. Was transferring your license, APRN license difficult? You were in Hawaii and then you moved to Texas. Was the transfer hard?
The transfer of my license itself wasn't. I just had to study and take a test on the particular Texas laws. And then once I did that, and the test was really straightforward. Once I did that, passed, then it was more of just gathering your documentation, registering for the license here, proving you had a license elsewhere, paying the fees, and then just waiting for them to process it. So that wasn't difficult at all.
That's interesting. I think it might not be a bad idea to test for the law because each state has different laws. And I think everybody should, because you don't want to violate the law without actually intentionally doing so. So nurse practitioners in Texas don't have full practice authority. Was it something difficult to adjust to?
So that, I would say, out of everything, was the most surprising part of it for me. When I started in Hawaii, I was new. So I loved the fact that the provider was available. I could always ask questions. And he was not a micromanager at all. He always asked me what my thoughts were first and let me think through things, especially when I first started out. And there was a sense of partnership in Hawaii that I just absolutely loved with the physician that I worked with. And then moving to Texas, I don't think I really realized it initially that it was a restricted state, which is probably silly on my part. But that really wasn't in my thought process. We knew we wanted to start a family. We wanted to be near family. And my family's in Ohio. My husband's is here in Houston. And I said, I don't want winter. So we're doing it in Houston.
And Houston have amazing healthcare facilities. So like in
absolutely.
Korea.
Yes,
Sounds
absolutely.
Like
yes. So yes, moving to Texas and then being hired at MD Anderson and probably also just the type of organization is number one in the US for cancer care. You are seeing a very special population that had been referred from other cancer centers, even worldwide. We would see people from out of the country quite regularly. And so it was a shift in the way I practiced. The clinic, instead of becoming an independent clinic where I had my own panel and the other providers had their own panels, it was a co-managed clinic. And so every MD was assigned a nurse practitioner or PA to partner with and run their panel together. Thankfully, the physicians I worked with were absolutely phenomenal. And once they got to know me and saw I was reliable and competent, I did get a lot of freedom and I was able to see patients independently and just forward mine over to the doctor and have them sign off and things. And it was also a benefit because of the complexity of these patients.
Mhm.
Oftentimes, chemotherapy was involved or immunotherapy was involved, and I would need that MD's input
Right.
on things just because I was not an MD and I did not specialize in oncology.
And I
but-
would think that MD, I don't want to say regular MDs, but other MDs also might feel like it's very complex. Like the MDs, CEOs work at the MD Andersons are probably one of the top-notch physicians in the world.
Absolutely. Yes, they are. Yes. A lot of them are the authority on certain endocrine related neoplasms and malignancies. And if you search anaplastic thyroid cancer, you're probably going to see Dr. Maria Cabanillas' name come up, and she was one of the physicians. They are very much at the top of their field. But going back to your question, yes, the transition from Hawaii to being a fully restricted state was different. I was grateful for it at MD Anderson. I think if I would have gotten a job in more of a private clinic setting, it may have been harder for me to transition just because I was used to more of that freedom and having that autonomy. But it also depends on the providers you're working with as well and the personalities and things like that. So.
And nurse practitioners in Texas are still fighting very hard, along with nurse practitioners from other states, including me, try to gain the full practice authority.
Yes, we need it. So just to allow for more access.
Yeah, especially rural areas who they want to have physicians, but there are no physicians want to work in the field, and the patient cannot get the care right away. I hope you are enjoying this episode. Before we go back, I want to quickly mention that I'm giving a gift to you for listening to this episode. I'm giving a free PDF nurse practitioner job interview prep checklist. This checklist is full of questions that you're likely to be asked during job interviews as a nurse practitioner and some tips on how to prepare for them. With this downloadable PDF, you can prepare for interviews well so you feel confident and stand out from other candidates to get the job that you really want. To get this free PDF nurse practitioner job interview prep checklist, you can go to usa.jnpproject.com/interview. Again, usa.jnpproject.com/interview. Now, let's get back to the episode. Now, I want to unpack the point that you mentioned a little bit. So you said the physicians eventually figure out you're competent and started to feel more comfortable to let you be more independent. How did you convince them that you are competent?
That's a great question. So it was really through reporting off to the physician after seeing a patient. So you see your patient independently, do your physical exam, you ask all the health history questions, and then your pertinent health questions, the reason they're there, digging into all of that. You come back out, you give off report, and then you develop your plan. You say, okay, this is a 70-year-old female who's here for breast cancer management. She's going to be on an aromatase inhibitor. We know it's going to lead to bone loss. She already has osteopenia. We see it's trending. Her scores are declining. I really think it's going to be beneficial to prevent fractures. We enter the FRAX score. It comes out she's high risk. And so I think we should start whatever medication. And just them seeing, I'm thinking through this. I'm thinking of the potential adverse effects. She doesn't have any of those issues. Here's my plan. I think we should see her back in a year, repeat her bone density. And after doing that for a couple of weeks, a few weeks, I think they learned like, okay, she knows what she's doing.
Yeah, that's awesome. And I precept nurse practitioner students, and I always have them practice how to do case report like that. Instead of, I think as a nurse, we're used to reporting, but the way of reporting is a little bit different. As a nurse, you can throw informations and then let the provider decide what's going on.
Right.
But as a nurse practitioner, you have to show, this is what I'm thinking. And then in the
Yeah.
end, what do you think? Is that okay? That's
Right.
the only thing. Instead of, hey, this is all I
Here's the- yeah.
yeah. And
Yeah.
then
And
tell
it's
me
like, now you choose. Yeah.
yeah.
What do you
So,
think?
yeah.
That was definitely a change in thought process when I 1st
Mhm.
graduated was, no, I need to go in there. I need to be prepared. I need to have the assessment, the plan, the follow-up plan. And once your provider sees, okay, she's thinking through this, I can see how she got to this plan. And even if it's not right, because not every time was I correct. There were things that the provider knew in this patient's health history because they had known her longer or whatnot.
Mhm.
Or maybe it was just a difference in opinion. Yes, a
Mhm.
bisphosphonate could work. However, her spine is the most severe aspect of her osteoporosis. So I think this other medication might be more beneficial to her. And
Mhm.
those are the pearls that you learn along the way. So then the next
Mhm.
time that a patient similar, you're like, oh, I remember this is how we're going to go and walk down this road with this patient. That was really,
ca-
was a wonderful opportunity.
Yeah, it's awesome. I feel like we have to show like what our thought process, like you open your scalp and then here's my brain thinking, and you literally have to show the thought process of and like you said, even if you are unsure to, like maybe you want to ask questions to physicians or specialists or senior nurse practitioners, very important to not just throw in questions, but you say, this is what's going on, and I think either or, I'm not too sure, I can't really decide, but this is a reason why I choose two options, and what do you think? So you really have to get to that point. And then people will see, oh, she knows what she's she's really good. And I think that's the best way to convey your competence. You can't just say, hey, I got a great GPA. So it takes time, but I think
It does take time.
yeah, that's so wonderful. And winning the MD Anderson physician's trust is good for you, girl. I'm so proud.
Aw,
That's
thank you.
amazing. I went to the same school.
You're amazing, Dr. Miura. Look at you.
Then you change your specialty to love of your life or palliative care. I remember when you were a nurse practitioner student, you were working in palliative care, and school was hard, balancing work and school was hard, but you loved the job. How is it working in palliative care as a nurse practitioner?
It's wonderful for my season of life. I love hospice as an RN. I started out as a weekend on-call nurse, and that really pretty quickly turned into a Monday through Friday role where I got involved more in the management side of things. But I absolutely loved it. I didn't know when I graduated with my RN license that I would do that. My goal was to work in labor and delivery, but that was not the plan that the Lord had. And I was totally, in the end, this was much better for me. And of course, he knows more than I do and always has what's best and better than what we could think or imagine. But hospice has always had a special place in my heart since I started in it. I really feel like you get to be bedside. You get to take time with a patient and family, make a really significant difference in a very vulnerable and tender season of life. And for me, it is very fulfilling. It's not for everybody. I understand that. So when I decided to take a step back from MD Anderson, this was after my third baby, and with my husband being gone so much, and I had a pretty long commute downtown to the med center, I really wanted to get back into hospice. And I wasn't in a rush. I did take some time to just focus on my family and cultivate a new normal and routine. And after, I believe it was about a year after I took a step back from MD Anderson, that's when I re-entered and got back into hospice care. And as a nurse practitioner, it is wonderful. The flexibility is phenomenal. I work PRN, so as much or as little as I want. And I definitely feel in this role, I have a lot more autonomy in my schedule, just seeing patients when it works best for me, of course, respecting what the company needs and when they need the patient seen before their next interdisciplinary group meeting. to review them. But yes, so I basically will go and I'm the eyes and ears of the physician. I do an assessment to make sure that they still qualify for hospice and Medicare benefit and Medicaid benefit. So it's been an amazing opportunity to be able to get back into that.
And I think palliative care is one of the areas that the nursing shines the best because we're not focusing on curing the disease, but caring is the focus. And I think nursing shines in palliative care. So maybe can you give us an example of what your typical workday look like for people who are interested in becoming a nurse practitioner in palliative care, but can't have a good image of what it is like?
Sure, absolutely. I will get a list of patients from the office that need to be seen by a particular date. And then I have the flexibility of scheduling those patients around my life schedule, which can be pretty hectic. And I go to the patient's home, or alternatively, if they're not in a home, they're in a long-term care facility, then I go there to see them. Hospice patients can be on the service for a number of different reasons, whether it be heart failure, end-stage COPD, cancer, Alzheimer's, stroke, Parkinson's, and then there's other reasons as well, but those are typically the more common. And with each of those diagnoses, there's certain criteria that patients need to meet in order to establish care with hospice, but then that criteria needs to be maintained. And then each benefit period, after benefit period number 2, we're going out to look at the decline over that benefit period. So a lot of the things I'm looking at is their alert and oriented status. Has that changed at all? Have they gone from being ×3 to now maybe ×1? Or have they gone from being communicative and able to carry out a normal conversation to now being really confused and having more tangential speech or more confused speech pattern or being nonverbal? And then oral intake, weight loss, the amount of hours that they're sleeping, has that increased? Has their output decreased? Symptom management, is there any nausea or vomiting going on? Is there any anxiety, agitation? Is there any dyspnea or increased respirations that we need to manage? Pain is huge. That's like a very surface level, but those are all the things that I keep in mind when I go out. And it's really just capturing what did that patient look like a month or 2 ago and how is that different from today? And really just trying to contrast the differences, the decline that we see, and to really substantiate this is why they continue to need our service. This is why they need us coming. So yeah, that's my typical day. And I may see 2 patients. I may see 4 patients in a day. There's times where a couple weeks will go by and it'll be quiet. And then I'll get a list of patients that need to be seen. So it really just depends.
How does the PRN schedule work? It's not 8 hours per one. How does it work?
No,
I can't even imagine.
That's a great question. Yes. So I don't have any on-call. It's not like an 8-hour shift. It's a per visit pay. So yes, I go and each visit that I make, that's how I'm compensated. Yeah, it's not like a shift or anything like that.
Interesting. And how do you, for folks who are watching from different countries and not really familiar with how palliative care works in the United States, so how do you interact or work with registered nurses in palliative care in your where you
Yeah, I would say the RNs and the CNAs are the backbone, and also the social workers. So I guess everybody in that group is really, they're all really working hard for these patients. But the registered nurses are the case managers of the patient. And so they are the point of contact for everything. So I definitely, even though we're not necessarily working side by side, there's still a lot of coordination that goes on behind the scenes. Whether it be a symptom management issue, the registered nurse and I will communicate about that. I'll send over, hey, I see they're taking this. I recommend perhaps we increase the dose or increase how often they're taking it, or let's transition to something else. And alternatively, the case managers are wonderful and will give me a heads up. especially for any behavioral issues or maybe social family dynamics that I might need to be aware of before going into the home, just so I can enter and just know, okay, there's a lot of displaced grieving going on right now, or things like that. But they really are the point of contact for everybody on the team. And so they carry a huge responsibility in hospice.
And then also, what's the relationship with the physician and nurse practitioner in your field or where you work?
Yeah. The medical director is basically the overseer of all things clinical. And typically every week they will meet and review patients. And this is an opportunity for case managers to bring up any questions or concerns and to also certify or recertify patients who are on service. My interaction with the medical director is very limited unless they have a question about a patient that I saw. I really don't hear much.
Wow.
So, yeah.
You are very independent.
It's very independent.
That's awesome.
Yes. So I do really enjoy it for that. I'm not, and this is probably something I need to work on and have a little humility in, but I'm not a type of person that loves to be micromanaged. So having the autonomy to get out and see patients and have the flexibility in scheduling and have the flexibility of staying with the patient for as long as I need to, it's really a privilege. It's great.
Awesome. I know the time is pushing, but I really want to ask about, you talked about that this PRN job really works with your schedule. So can we talk about your family life, being a mom of three? The three children are so adorable. They came happy to be their boy auntie, but they're still very young. Your husband is gone for the job all the time. And how do you manage the balance between work and life?
Yeah, it's a funny thing, I think, and it may be an unpopular opinion, but once you become a mom, your priorities in life, at least for me, I'll speak to myself, really did take a shift. And after having my third, Noah, and with my husband having the career that he does, I just really saw how much I was needed at home and how much stability that was needed and required for my kiddos and just for my house to run well. And I don't know if there's a perfect answer for what does balance for you look like.
Right.
But for me, it looked like taking a step back from a very intense career and focusing on putting my family first and finding joy and getting back into my career and having a taste of it again. Day to day, to back up a little bit, my oldest is 7. Her name is Jules. I have Theo, who's 5. And then Noah, she's about to be 3 and just a few days on the 7th. And they're quite little, quite needing an adult around, and their mama, of course. I homeschool part-time. So they go to a school where 2 days a week they go on campus and the other 2 days a week I homeschool. So that's a really great opportunity that I've had, stepping back at being there to help nurture and guide them in their schooling. That's been really amazing. But yeah, I don't know what balance for everybody looks like, but for me, it just looked like taking a step back and reevaluating what my priorities were, realizing I have a very short time with these kiddos being young and just really wanting to embrace that and enjoy what I can in those years, and also still having that time where I am back in my career. So that's why hospice has been such a blessing, because I do feel like I have the best of both worlds. And then at the same time, I've been able to expand into other things that the Lord has called me to do, writing those books and becoming a foster care home. I don't think that ever would have happened if I would have continued at MD Anderson. For a fact, I know it wouldn't have happened because it was just too much. It was a very intense career.
Yes, and then knowing you from, you guys are still dating when we were in the program, and then you got married, and then you started a family, and now a mom of 3, but you haven't changed in a good way. That, I really look up to you as a mom, because you're very loving to your children, and you guys have a very good relationship. In that sense, you haven't changed. You are still Toni that I know from 10 more than 10 years ago. 13
It's been more than 10, girl.
Yeah, I think there is no like exact parameter of what's the work-life balance, but from my perspective as a close friend, I think you are being very successful in that. And I wonder, becoming a nurse practitioner helped you to get the freedom of choice that you can choose how you want to work, how you want to live, basically.
Yeah, I think that's one of the amazing things about the field of nursing is there are so many different opportunities out there. It's like you can really almost do anything from teaching to, I know I have some friends who are a school nurse or they're a director over the school nurses. And so they have a summer schedule and then they're off for the summer. There's just so many different opportunities in the field. And that if you are looking hard enough, I really think there is opportunity for everybody in a niche that they're looking for or something that will fit their lifestyle that they're looking for. I will say it was very challenging. It was a really hard choice at the time to step back from MD Anderson because as we put blood, sweat, and tears into our degree, we spent a lot of money on it. And so stepping back, because my career had been my identity for so long, was a really hard decision. But once I had prayed over it, I just remember driving home one day and there was just a sense of peace that came over me that the Lord provided, that I blessed you with these children and this is the time to step back. And it was just this peace that I could not explain. And I just knew, okay, I know what I need to do. And I have zero regret. It has been the best decision. And then I just feel like, what a blessing that I remember telling a friend, if I ever got back into healthcare, I would really want to do hospice. And that friend looked at me and said, oh, that's so funny. My dad works in hospice. And that's how I got back into it.
My goodness. That's amazing.
Yes. Things will happen for a reason. And there's just so much opportunity out there for many different types of lifestyles. It's just what you're looking for. And I think there's going to always be a sacrifice on one end or another. But once you have a piece about what it is you want to do, there's going to be an opportunity there for you.
One last thing, do you have any advice on nurse practitioner students or new grad nurse practitioner?
Yeah. I have actually a couple if that's okay.
Amazing. Yes.
One would be stay connected with the people you went to school with. I know that looks different these days with a lot of it being online. However, I know that there's text groups that form. If possible, I know time is such a limiting thing. If possible, meet up for coffee, get to know your fellow classmates. They are going to be the people that are going to grow with you in your career and be the people you go to for that curbside consult, be the people you go to for job advice. For, hey, I'm looking into this new role and I'm in the middle of negotiations. What do you think about this? So definitely keep in contact with your fellow classmates because they're going to be the best resource going forward in your career. If you can get a mentor, get one, whether it be at the practice you're at or whether it be maybe somebody who's a little ahead of you in your career that, again, just to be able to touch base, ask questions, they've got more wisdom. And wisdom is never a bad thing. Thirdly, I would say don't limit yourself to just interviewing for your dream job. I would say go out and interview for every position you can find. Even if it's not something that you would potentially consider practicing, interviews, it's a skill. And for some people, it comes more naturally. It does not come very naturally for me. I get so nervous. I was nervous about this interview.
I can't believe it.
So I would say get out there, interview, because the more you do it, the more you're going to be comfortable with doing it. And then you just never know where you're going to end up. And if you have multiple offers, you can catch them against one another when you're negotiating. And that's only going to benefit you and your career and the next years of your life. That would be my advice.
100% for all your answers. I think having a classmate friend seen probably the worst of you. most irritated, looked really bad,
Exhausted.
and miserable, exhausted, everything, and still be friends with you, and also, and then also going through the stress of being in school, working at the same time, being a new grad, but to have somebody who are going through exactly the same thing as you. Very soothing, or at least know that you're not alone. That was
Absolutely
really helpful. So, and if in the future if you get a award or something, and then your friends show up from the other state, you go through the journey together. And especially for those friends who will be there when you're sad, but also who will be there when you're happy and celebrate your wins. Those are the bold friends so try to find those friends. And I think in this digital world, I think it's still possible. Like you said, try to be proactive about connecting, because other people might be looking for the connection as well. So
Absolutely.
Thank you so much, Toni. I just had a chicken
Thank you,
skin.
Dr. Mira.
But I hope you guys learned so much from Toni. She is so amazing, and her work on the children's book are amazing too. So make sure to check that out. I'll put the detail in the comment section. But thank you, Toni. I'll talk to you soon.
Thank you. It was so good to see you, Dr. Mira. Thank you so much.
I hope you enjoyed this episode. Please give me a thumbs up if you like this video, and don't forget to subscribe to my channel. I upload a new episode every Friday. Also, please comment any questions or requests for future episodes. All right, I'll see you in the next episode. Aloha.